Welcome to RX Report. Today we're exploring the efforts surrounding HIV prevention, how pharmacist access plays a key role, and a big question shaping the future of public health. I'm your host, Manuel. Let's dive in. HIV is a powerful disease that, left untreated, can lead to AIDS or acquired immunodeficiency syndrome. First discovered in the 80s, efforts to cure and treat the virus have been in full force, as those living with HIV have often had to overcome massive amounts of prejudice and hate from others. It's an incredibly difficult situation to be in. However, over the years, methods to treat HIV have grown, making what used to be a fatal diagnosis into something much more manageable. As more people live with HIV and are living longer, preventing the spread of the disease has become a real public health concern. With advances in modern medicine, scientists have developed regimens that greatly decrease the likelihood of an individual contracting HIV, called pre-exposure prophylaxis, or PrEP. There's also post-exposure prophylaxis, or PEP. Those options are in addition to those that exist to treat those who may already be living with HIV. Science works! The first available medication for HIV PrEP or pre-exposure prophylaxis was relatively recently approved by the FDA in 2012. PrEP is an evolution of years of trial and error antiviral therapies that have had mixed results of treating HIV, but were found to be highly effective at preventing HIV. With PrEP, a regular, consistent regimen makes the possibility of contracting HIV far lower. Now that sounds pretty good, so PrEP should be easy to access for all who need it, right? If you work in community pharmacy, ambulatory care, hospital, outpatient, whatever your practice is, you've probably had a patient ask about HIV prevention and felt that tension between what you know you can do clinically and what your state law or workflow will actually allow. Now, the good news is that PrEP is available with a prescription and readily accessible across the entire US. The bad news is that many people don't really see a general practitioner regularly or even at all, but they do see pharmacists. Some studies even suggest that patients interact with pharmacists up to 10 times more frequently than their primary care physicians. Now that makes sense since you're often the most accessible healthcare professional in your community, and for a lot of your patients, the most trusted. So, can pharmacists prescribe PrEP? Sometimes yes and sometimes no. And in many states that's changing right now, which means depending on where you practice, your ability to help patients can look completely different even if you have the same training and skills. Let's break it down. Pharmacists are uniquely positioned to expand access, especially in rural or provider shortage areas, because pharmacies exist in nearly every community. Multiple states have granted pharmacists the independent prescribing authority for PrEP, like all of these ones here. Now, read the map yourself. I'm busy, but there's also a link in the description if you want to check it out yourself. Now, props to the western states that led the way in expanding pharmacists' ability to prescribe PrEP. Now, while those earlier states can have pharmacists prescribe and then provide PrEP access, you'll notice that there were a lot of other states that didn't make the cut. A few states use a prescriber protocol, which allows multiple patients and does not require a past prescriber-patient relationship. Some states still require what's known as a collaborative practice agreement, or CPA. A CPA is not to be confused with your annoying tax-conscious roommate telling you to invest in bonds. A CPA is more of a written agreement between a physician and a pharmacist that then allows the pharmacist to provide a specific type of patient care to said physician's specific patients. Not a bad idea, but it does require patients in need to sift through who knows how many doctors until they can get on one physician's Rolodex that works with a pharmacist, and that's assuming the physician has any room in their schedule. Basically, it adds a hurdle to an already extremely difficult situation, and many of the states that allow pharmacists this partial authority still have extra boxes to check, depending on the state. It could be things like training requirements, or supply limits, and notification rules. As annoying as that sounds, it's still not as frustrating as it is in states where pharmacies have zero independent authority to prescribe PrEP. Some states have dug their heels in, not allowing any prescription for PrEP without a doctor's direct prescription. So, yes, it could always be worse, but like I told my dad for many Christmases because I was a terrible child, it could be a lot better too. Especially when you know you're capable of helping, but the law simply won't let you. Or Buzz Lightyear was out of stock, one of the two. But this is where things get interesting. Despite hurdles still up in way too many states, progress is being made. For instance, Delaware now allows pharmacists to provide PrEP under a 2024 statewide protocol. Georgia lawmakers are pushing forward legislation that will allow pharmacists to prescribe HIV medication, specifically to improve rural access, another issue we've spoke on many times on this show. According to APHA's new member resource, State Legislative Tracker, Across the U.S., Pharmacists' Prescribing Authority continues expanding via test and treat models, and scope modernization bills introduced in multiple states. That momentum isn't accidental, it's the result of pharmacists showing over and over again that when you're allowed to practice at the top of your education and training, patients benefit. Now, that's great news, so what's the motivation behind the change? States are beginning to recognize that many communities simply don't have primary care access and are noticing that pharmacies can fill that gap. Now, to further answer this question, we brought on Michael Murphy, APHA's Senior Advisor for State Government Affairs. Michael, thanks for being on the show. Can you tell me, why are pharmacies not really able to prescribe PrEP by default?
Yeah, absolutely. So the reason that pharmacists aren't able to prescribe consistently across the country is largely because of antiquated and old laws at the state level that determine what a pharmacist can and can't do. That's commonly referred to as the pharmacist scope of practice. And as we've seen the roles and responsibilities of pharmacists evolve over the past several decades, we've seen expansions in some of those state laws that better reflect what a pharmacist is educated and trained to do. And a key component of that is prescribing preventative medications like HIV, PrEP, and PEP. And we're seeing a growing number of states update their laws to make sure pharmacists have that authority to provide those preventative care treatments. But we still need a lot of advocacy work across the country to make sure that patients are able to go into any pharmacy, any location where a pharmacist is practicing, and a pharmacist has the authority to provide the services that they're already educated and trained to provide. We just have these old, outdated laws that limit them from providing those services.
And how has the growth in number of pharmacies able to prescribe directly affected the HIV epidemic?
Oh, yeah, absolutely. So we're seeing more and more states that are updating those laws that I was just referring to. So as of the time of this recording, over 18 states have some authority for pharmacists to prescribe HIV preventative medications. And we're seeing a lot of the more recent discussions around states that are looking to update those laws happening in states where there's higher prevalence of HIV infections or higher HIV transmission rates. So not only are we seeing that increase in consistency across states where pharmacists have greater prescriptive authority, but we also see public officials in states where there's those higher rates of HIV transmission specifically looking to pharmacists as a tool to help to decrease rates of HIV transmission in those locations. So I believe that as we continue to see these laws get updated and more pharmacists have the authority to provide these services, we will continue to see pharmacists being a key preventative measure for additional HIV transmission and hopefully helping us to eventually end the HIV epidemic.
Why are some states allowing pharmacists the ability to provide this direct care while others are dragging their feet?
Of course. So it really just comes down to the natural process that we see in states in updating old laws and how we define what a pharmacist is allowed to do and what a pharmacist isn't allowed to do. And it really comes down to pharmacists stepping up and advocating for the changes that they want to see in their practices to ensure that they have the authority to provide all of the different services that they're already educated and trained to provide. One of the exciting things that we're really seeing, in addition to pharmacists stepping up, is a growing number of patients stepping up and advocating hand in hand with pharmacists to ensure that pharmacists have the authority to provide these services that we're describing here. So not only is it pharmacists stepping up, it's patients saying, hey, we really value what pharmacists can do, and we are really excited by the opportunity for us to potentially receive different preventative care services like HIV, PrEP, and PEP from pharmacies, and they're going to their lawmakers with pharmacists and saying, hey, we need to update these old laws to make sure that pharmacists are a accessible location to receive HIV, PrEP, and PEP, and a bunch of different services that pharmacists are educated and trained to provide. So I believe that, it's going to take time for us to advocate and to make these changes. The public policy making process tends to be slow. But when pharmacists step up and they're the ones, speaking truth to advocate for the changes that they want to see, and they're partnering with patients, we can really accomplish anything.
Is there danger in allowing pharmacists to directly prescribe HIV PrEP?
No, in fact, there is danger if pharmacists do not have the ability to provide HIV PrEP and PEP. I mean, let's look at HIV PEP as an example, which is post-exposure prophylaxis. This is a very important medication that patients need to get access to within a very short time window after they've had a potential exposure to HIV. We need to open up as much accessibility as possible for patients to be able to get that medication from a trained healthcare professional in a safe environment to ensure that that patient is able to quickly access it and they have as good of a chance as possible to not have a potential transmission of HIV. Pharmacies can be another great access point to receive these medications from that trained healthcare professional, a pharmacist. And we really need to make sure that we are doing everything that we can within our public health infrastructure to make sure that patients have access to these medications and preventative services that help to prevent more expensive chronic conditions like HIV, as opposed to putting up ancillary guardrails that limit what a healthcare professional is trained and educated to do because of perceptions that they shouldn't be providing a specific service, when in actuality, there's lots of documentation and evidence to show that they can safely and effectively provide these services to patients and are doing so right now in many states.
Where can pharmacists go to get more resources to better provide HIV care?
Oh, absolutely. So I have to put in my plug for APhA. I think that they do a great job providing a lot of educational resources for pharmacists to help them better understand the clinical aspect, how to implement these services within their practice settings, but then also how to effectively advocate for the changes that they want to see within their state laws. So APhA, I really feel like, can provide that full gambit of resources, both the clinical expertise, that implementation business aspect, but then also the advocacy resources that you need to update state laws so that you can practice at the full height of your education and training.
Pharmacists are becoming more recognizable as frontline caregivers instead of just medication dispensers, and in a country where it can take months to see a GP, any bit of help from a medication expert is definitely welcome. Now, with this momentum, eyes are on lawmakers to keep it up with changes in other states to empower pharmacists, provide expansion beyond CPAs, include things like more statewide protocols giving pharmacists the tools they need to assist patients, and allowing fully independent prescribing. We'll keep it going in a second, but first, did you know that your ticket to LA is ready for the taking? APhA 2026 is happening in just a few weeks, and you're not too late to grab your seat. Meet industry leaders, nab CE hours, and redefine what's possible for the profession, all in one conveniently sunny location. Whatever you need to get out there, APhA has got you covered. Need to convince your boss to pay your way? Check out our justification toolkit. Need a guide on who and what to see at the show? Take a peek at our fully interactive show schedule and explore your options. And don't forget, it's LA, so don't forget to see the sights, grab some beach time, and make your trip one for the history books. Don't wait. Scan that QR code or go to aphameeting.pharmacist.com to learn more. Again, that's aphameeting.pharmacist.com. See you there. Now, if pharmacists are going to sustainably expand access, reimbursement has to be part of the conversation. Clinical authority without payment isn't a long-term solution. APhA is currently advocating for the PrEP Access Act, which would reimburse pharmacists under Medicare Part B for prescribing HIV PrEP and PEP, as well as for providing the essential testing, counseling, and medication administration services authorized under state laws that patients need. As mentioned earlier in this podcast, several states already authorize pharmacists to provide PrEP and PEP, and this legislation helps ensure that your time, expertise, and patient care are recognized and paid for. If you'd like to see this change in your own practice, check out the link in the description to use APhA's pre-written, editable advocacy alert to urge your members of Congress to support the legislation. On the resources front, APhA also offers a certificate training program on HIV prevention services that covers state fundamentals for the pharmacology for PrEP and PEP medications. 12 hours of CPE and a micro-credential available for technicians. It covers everything you need to know to get started with HIV prevention. While the CTP program dives deep into the clinical side of HIV PEP and PrEP inside APHA's Practice Implementation Center, which launched earlier this year, and is included for free with an APHA membership, there is also the HIV PEP PrEP Toolkit, which is all about helping you actually stand up and run these services in your pharmacy. You'll find things like resources and worksheets to help estimate associated costs and revenues with your new HIV PEP PrEP service and promote a business case. There's also guidance on elements to consider when developing CPAs with providers. You'll find an overview of relevant rules and regulations within your state to guide program and workflow development. You'll also see considerations for documenting clinical services and tracking outcomes. There's also professionally designed, pre-written, customizable templates to market services to patients within the pharmacy. So, if you're an APHA member and you're serious about launching or expanding HIV prevention services, this toolkit is a great place to start, and it's available to you right now. Check out the link in the description to explore it, and if you're not a member, there is no better time to join than right now. So here's the reality. Pharmacists are already providing HIV prevention care across much of the country, but how independently they can do that is still heavily dependent on your zip code. But with new legislation moving and access gaps still driving policy decisions, one thing is clear: your role in HIV prevention is only getting bigger, and that progress can't come soon enough. The question isn't whether pharmacists belong in this space, it's really how quickly the laws will catch up to the care you're already capable of providing. But wait, we're not done. I can't let you leave this week's RX report without hearing from Brian for today's Pulse on Practice segment. Brian, take us away.
Thanks, Mason, and hello everyone. Today we're spotlighting new federal legislation pharmacy staff should know about. H.R. 7189, also known as the PrEP Access Act, introduced by Rep. Pocan, the chair of the Congressional HIV/AIDS Caucus, on January 21st of this year. This bill would require Medicare Part B to cover pharmacist-provided essential HIV services, including pre-exposure prophylaxis, known as PrEP, and post-exposure prophylaxis, known as PEP, evaluation, screening, counseling, and medication administration. This means patients can access timely care at the pharmacy, and pharmacists can receive payment for their clinical services. It is important to note that this bill doesn't expand pharmacists' scope of practice at the federal level. This act simply ensures that Medicare covers and pays for pharmacists' clinical training and expertise when providing HIV PrEP and PEP services in the over 16 states that already authorize pharmacists to furnish them. According to the CDC's most recent surveillance, as of 2023, more than 1.1 million people in the United States are living with HIV. Additionally, over 39,000 people in the U.S. received a new HIV diagnosis in 2023, and the lifetime HIV-related medical costs is estimated to be over $400,000 per person. And by 2030, estimates indicate that nearly 300,000 people with HIV will reach 65 and become eligible for Medicare. Therefore, the need for effective preventative HIV care will only become more critical, and pharmacists can help by addressing these barriers to accessing antiretroviral treatment. This bill has been referred to the House Committee on Energy and Commerce and the House Ways and Means Committee. This is the perfect time for you to get involved. Visit APHA's Advocacy Action Center or click the link in the description to send an email to your member of Congress. Together, we can showcase the power of pharmacy. Stay up to date on this and other advocacy efforts by heading over to pharmacist.com/advocacy. That's your go-to hub for everything APHA advocacy. Back to you, Mason.
Thanks, Brian. And thank you for watching. What do you think about pharmacists' potential ability to prescribe and monitor care for those seeking HIV prevention? How do you feel about how your state deals with PrEP access? Let me know in those comments below. Till next time, our executive producer is Rob Hodges, our creative producer is Kate Erdmann, our editor is Michelle Powell. And until next time, I've been your host, Mason Manuel. Be sure to tune in next time for our latest RX report. But till then, bye y'all.